me. So I'll call upon members of the board to give me an agenda approval so I can move forward. And please state your name, because it's very difficult for me to try to follow here.
Robert Mach, I'll move.
Thank you, Robert. Supported.
Gary Kashak.
Thank you, Gary. Then we'll move on. Is there any announcement of conflict of interest on the agenda as presented to you today? All right, I hear none. So we'll move on to 4.0 and 4.1, the COVID-19 update. Dr. Nazateri.
So members of the Board of Health, Board Chair, Mr. McNamara, my colleagues, thank you so much for asking me to speak today and allowing me to share my perspective. I think it's fair to say that we're in a period of increased disease activity, and some have characterized this as the seventh wave. And we know there's increased disease activity because not only do we have greater cases, but we also have a larger number of outbreaks, potentially higher levels of positivity on the testing. But the real issue is that we're going to have to learn to live with COVID. And learning to live with COVID means that there are going to be periods of increased disease activity and decreased disease activity. And during periods of increased disease activity, we may have to modulate our public health measures based on the risks that we currently see. Living with COVID means, among other things, regular vaccination, access to antiviral meds for people who need them, allocating the right amount of hospital space and resources based on clinical demand, physical distancing, washing your hands regularly, as well as something that we don't always want to accept, which is that we have to allocate and accept risk based on certain activities. It's likely that during times of greater disease activity, that large events and indoor dining probably have greater incidence of getting COVID. I want to share one point which I think is important. Is earlier today I had a meeting with hospital colleagues and other healthcare leaders. Right now in Windsor-Essex, there are challenges with emergency department waiting times, and perhaps the surgical volumes that we would want to see are not there. So I think that we're in a period of time where Windsor-Essex is experiencing additional burden of disease, but also in the background, hospital capacity and healthcare capacity is strained. More recently, the province has announced that there's going to be greater eligibility for vaccine. Specifically, people between the ages of 18 and 59 will be eligible for additional vaccine. Stated another way, when we vaccinate people, we give them a primary series of vaccines, a group of initial vaccines, and then we provide boosters or revaccination as immunity weans or wears. This is true not only for COVID vaccine, but this is also true for tetanus, and it's true for whooping cough. If I could share generically, if people might ask us and ask me, why should I get vaccinated? Well, generically, vaccination on an individual level is, I don't want to get sick. The person vaccinated doesn't want to get sick. And you want to minimize that if you do get ill from a particular disease, that you have minimal adverse consequences and that you don't have long-acting symptoms. And people at an individual level want to get vaccinated or consider vaccination when they don't want, or they want to prevent their household members and friends from getting sick. But vaccination is not just about the person getting vaccinated for the benefit of themselves or their family or the people that they know. Vaccination is also about the broader community. It's about doing something that might help someone beyond someone you might know. At a community level, which is what the Public Health Service is most focused on, is that the more people that are vaccinated, the less likely there is going to be a burden of disease in the community. And we already know that the local health system is challenged to meet its current the current situation. So a larger population of people who are vaccinated are likely to lead to a reduction in hospital resources, a reduction in other healthcare resource utilization, and also lower societal disruption. people being a lower number of people missing work because of illness. So the health unit, in the context of the fact that Windsor-Essex has had a disproportionate burden of COVID-19, urges community members to become up to date. Now, what does up to date mean? Up to date means something different to people based on their age and their current health status. And being up to date means getting a primary series of vaccines. That's the initial series that's recommended. And then to get boosters or to get revaccinated to keep your immunity up. People that are vaccinated are less likely to get clinically ill. They're likely to have a shorter period of illness. They're less likely to infect other people. They're likely to have less viral shedding. And that's a benefit to the person, to their families, to the people that they know, and also to the people that they don't know, the broader community. In Windsor-Essex, we have 100,000 people ages 18 to 59 who are now eligible for the 4th dose. That means there are about 100,000 people who've got 3 doses in this age group and are eligible for the 4th dose. I encourage people to get the 4th dose. There are also another group of people that we're particularly worried about. There are about 25,000 people in this age group who've not had any vaccine at all. They're particularly vulnerable to the adverse effects of COVID-19. And there are about another 25,000 people over age 60 who previously were eligible for a 4th dose but have not got a 4th dose. I think it's fair to say that the health district really encourages people to get up to date. Many of the people who are up to date have had their last dose of vaccine 6 months ago, and there's waning immunity, meaning waning effectiveness of the vaccine. In closing, I'd like to share that although we are in a period of increased disease activity, we also are in a period of perhaps stretched healthcare resources in the Windsor-Essex Health District. We still have things that each of us can do to try to mitigate this risk to the community as we move forward, recognizing that in September and in the fall, we might have greater disease activity moving forward. So with that, thank you so much for allowing me to speak, and I'm happy to share any comment, try to respond to any questions.
All right, thank you very much, Dr. Nazatiri. Any questions or comments to our MOH? I just have one. I'm one of the 25,000 waiting for the so-called 4th shot, but I was told I had to wait because of I had COVID in late April and beginning of May, and so I was holding off till August, because they were talking about the 4th wave coming or 7th wave coming in September, October, somewhere, and I wanted to have my, I guess, the best protection possible, by waiting. So from what I'm hearing, I shouldn't be waiting then. I should be getting my 4th shot.
Yeah, so I don't want to comment on your specific case, but because there may be some complexities, and I'm happy to chat with you privately about it.
Okay.
But I do think that if you are eligible for the 4th dose, you should take the 4th dose. I know some people are reticent because they're hoping that or they feel that they might be delayed in getting the bivalent vaccine. But I think that at this point, given the burden of risk, I think that it's probably better to get the 4th dose now if you're currently eligible to get the vaccine. If you have equipoise or if one is concerned, they can have dialogue with their family doctors. But on a population health level, that would be my recommendation at this point.
Okay, well, thank you. No further questions or certainly comments. Motion received the verbal report. Dr. Nazatiri.
Tracy Bailey.
Thank you, Tracy. Support.
Joe Bacchetti.
Thank you, Joe. All in favor? Opposed, if any? None. Then that carries. Thank you. All right, 5.0, 5.1, the regular board meeting minutes of June 16th, 2022, and then the audit committee meeting minutes of March 25th, 2022, located on page 5, and the if I could have a motion on those minutes.
Gary
Move that
Kashak.
Reno.
Thank you, Gary. And Reno, support. Any errors or omission on those minutes as presented? All right, hearing none. I'm going to say opposed. The minutes carry. Thank you. Business Horizon 6.1, Board of Health Policies. I believe, Nicole, you want to address that?
Yeah, so both draft policies are in the package for your review. I'll maybe call on Lori if there's anything specific she wants to highlight. Again, these are just our continual updates as we move towards updating the bylaws and associated board policies. So certainly we're available now to answer any questions and know that the final draft will be brought back at a future board meeting when we've consolidated everything. Lori, is there anything you wanted to highlight around the borrowing policy or the user-free policy?
No, I think both are self-explanatory, but happy to address any questions that the board may have.
Okay.
You're muted, Mr. Chair.
Gary, I have a question here.
Yeah, go ahead, Ed.
My question to Nicole, actually, is the borrowing policy changes from year to year, or it's basically the same principle applied year after year? And the question, do we really have to deal with it on a yearly basis, or it's supposed to be part of our policy, continuous?
Go ahead, Lori's going to answer, so I'll let her go ahead.
So the borrowing policy, this is a one-time, we do the initial approval. There is a review process embedded in it. I believe it's every 2 to 3 years that it'll be brought back to the board because it is a board policy. It's not like perhaps the borrowing bylaws where you may need to refresh approvals like the municipalities might. This is laid out as policy and you would review it the one time. In the event there is any borrowing required under the policy, then those borrowings will be brought forward and discussed to the board for recommendation and approval.
So basically, there is hardly any changes to the policy.
Yes. And so this is a new policy. First off, we did not have this policy previously because of the changes that we made to the finance bylaw. We thought it prudent to bring forward a policy to discuss that. Any changes that would occur in subsequent review years would really be as a function of, best practices and what the board thought was appropriate to address in the policy.
Lori, thank you very much.
No problem.
Okay, any further questions?
I think Tracy had a question, but maybe not.
No, I'm okay here.
Okay. All right, thank you. If there's no further questions, then if a motion to receive the 6.11, 6.12.
Hey, Gary Kashak, I'll move it.
Thank you, Gary.
Support Reno.
Thank you. All in favor? Or I should say opposed, it'd be easier that way. Okay, hearing none, that is carried. Thank you. And Leanne, I'm okay. I was able, I received it. It came through, so I've got the whole package here. Okay, we've got consent agenda, which is actually none. We have no correspondence to deal with in information reports, but we'll go to 8.0, resolutions recommendation report, page 13 and 14. First one, 8.1, is the registered charity status. Nicole?
Yep, so I'll just, it's in your package, but I'll just share my screen as well. So this was previously just reviewed many years ago, where the health unit began to look at the ability for us to achieve a registered charitable status. We have had our legal counsel review this recently. Once again, obviously, there's a number of advantages for us having this designation. We would potentially receive rebates on property taxes for our leased premises. There are grants and donations and certain funding that we're not able to apply for or receive. However, if we were, designated as a charitable organization or nonprofit, we would be able to do so. In some cases, we work with other partners who have that designation and are a transfer payment agency, but certainly this would provide us a good advantage as well. Rebates and deductions through participating third-party vendors. So, for example, we have, some of our, some of the recent IT-related purchases, we would receive significant discounts for if we achieve that status. And as I mentioned, grant opportunities as well. The only real disadvantage would be it would potentially increase our financial reporting responsibilities related to having to required to file an annual return. And other than that, we don't see too many disadvantages to this. So we would like to recommend to the board, and the board approve for us to move forward with applying. So the proposed motion is, whereas we choose not a registered charity as defined by the Section 149 of the Income Tax Act, whereas registered charity status could result in additional funding, fundraising, and cost savings opportunities to the WeChew. And now therefore be it resolved that the Windsor-Essex Board of Health approve administration to proceed with the process of investigating and applying for registered charity status for the WeChew. And I'll just note that we have already, like I said, consulted with our legal counsel that we, do have the ability to apply. We just haven't moved forward with anything yet, and we're seeking your approval to do so.
Okay. Any questions or comments? Just a question or comment. Okay, I got two. I'll defer to Mark and Tracy. Mark?
Thank you. My question is just simply, do most health units in Ontario have this status? Is there anything to draw on from the experience of what others have done? I know that from my own experience with having that designation with an agency, it's minimal in terms of the additional requirements for filing, and it was never a con to have that designation. But I'm just wondering what others have done with regard to that.
Laura, do you want to answer? I can.
From my understanding, and I don't have the precise number of health units that do have the status, there are a number of health units that do have the status. And some of the benefits they have conveyed are, as Nicole had indicated, property tax rebates are an advantage of that. We've also had experience from other discussions with health units that they've received cost savings on account of buying subscriptions for licensing, for software licensing and such. So we are aware that other health units have that, but I can't speak to the exact number at this point.
Yeah, I don't have the number at our fingertips, but we often put out questions across health units to see, who has this, who doesn't. As well, our legal counsel did provide some examples that would be, health units, very similar or exactly like ours that do have that or have recently, obtained it. So as part of that, initial feasibility.
Okay. You all set, Mark?
Yes, thank you.
Okay. Tracy?
Thank you. My question was actually quite similar. I was wondering how many health units across the province would hold charitable status and whether or not we had that information, but hearing that we don't, I'm wondering if we might want to yield to a report. So I'll just put that out there for my colleagues, but I certainly would like a report to see how it's being handled by other health units across the province and, whether or not it's something consistent or if it's something that we would be doing in Windsor-Essex that is in isolation of the other health units. Thank you.
So if I can speak to that.
Yeah, go ahead, Nicole.
So we can provide a more comprehensive report in that regard, but we are not in isolation. So I can confirm that we are definitely not in isolation. There are other health units that do have this designation, but I can't tell you exactly. I can't give you on the fingertips my number. So if you'd like the exact number, but we can give you a report in that regard. But I just wanted to assure the board right now that based on the information we have obtained, we know we're not an island, that we wouldn't be the first to apply.
Yeah, and just on that, I'm just curious before I move on to the other speakers, you know, and it's something, I mean, we're having this conversation on this, when in fact, you know, we're part of the healthcare family, and then funded by obviously the ministry and the municipalities. And then you look at the hospitals, you know, and they're funded just like we are, and they have foundations where they go out and they you know, solicit funds from the community and raise funds and so forth. It's ironic that we're not even, you know, we haven't had this conversation a long time ago, because the reality is that, you know, you've got a healthcare entity, publicly funded, like hospitals, and they have the ability to do that in a more constructive way, obviously through a foundation. And I see other nonprofits that do that, you know, for various reasons. So I'm glad it's, you know, it's coming to the forefront, because it's another ability for us also to find other ways and means of funding opportunities to help, you know, our community. So it'd be interesting to see, as Tracy alluded to, what others are doing, how they're doing it, and if there's other opportunities to have that conversation with ministry and to see how we can certainly evolve. I could see, like us, a foundation, for example, where they either own the building or so forth, and we pay the foundation. You know, there's so many different ways of means that, you know, to help, obviously, us, because our only ways and means is what we get according to what the province allows us to, and nothing above and beyond that. And so it's interesting, especially when we're faced with situations where I've always said the unexpected, and the unexpected, you know, comes right out of our existing budgets. And then we have to go to the ministry or others and ask for additional dollars, you know, to help cope with whatever that is. And that could be like the West Nile virus is a good example of that, and so forth. So interesting. I think that it's great to have this dialogue and this opportunity. Robert, I believe you were next.
Yes.
Oh no, sorry, Gary Kashak, and then Robert.
Thanks, Chair. And you brought up a good point earlier about fundraising. So normally when you get registered charity status, people can donate funds to the organizations and get registered charity receipts. Are we going to be looking at this down the road? It's certainly going to add to our reporting. And I know, you know, you have to file yearly returns with Revenue Canada and whatnot, but would that be part of our basis of going with registered charity status?
So it's one option. It's one opportunity that we could provide charitable receipts for, but it wouldn't be the primary reason that we would recommend it. The biggest would be certainly the savings to the health unit. So our ability to stretch our public health dollars further. So as we mentioned, property tax has significant savings, as well as we mentioned third-party vendors, so things that we purchase, being able to take advantage of savings, some of which are quite significant. That would be the primary reason that we are recommending to pursue it. As well, not so much fundraising as much as grant opportunities. So there are grants of which it would allow us the opportunity to apply under, you know, if we had that status as well. So.
Well, thanks for that, Nicole. And certainly appears to be lots of benefits to moving forward on this. And I like it. I like the direction. I know it's not easy to get this status from Revenue Canada as well. I've been through the process on it with an organization I'm involved with, but I certainly like it, and I'll be willing to support Tracy's motion there. Thank you.
All right, thank you, Gary. Robert.
Thank you, Gary. I heartily support the motion and the concept. I would, however, like to point out, it's my understanding there's a CRA ITAR that has some guidance with regards to any voting member of the board being paid, and essentially it's a prohibition of it. So it may complicate the structure, but if there is a voting member paid by the organization, there are Income Tax Act complications with it. So that may trigger the need for a foundation or a different vehicle to make it all work. I just want to just draw to the board's attention that we need to have an open eye to this and make sure we don't run afoul inadvertently of that ITAR, because I've seen this happen in an organization before. The consequences are serious. Wind up owing a lot of federal tax, in other words.
All right, thank you, Robert.
Which is strange, I know, but how that could happen, but it has.
Yes, that's why I mentioned the foundation, where you can have a kind of a separation from church and state, but
yes,
but find the benefits from it. Nicole?
Exactly.
I was just going to say, I don't know if we're down the road of proposing, if we're already there where there's an amendment to the proposed motion, because right now it says administration to proceed with the process of investigating and applying. What I'm hearing maybe is we go through the process of investigating and then bring a fulsome report that includes all of the items that have been raised in full, because at this point, the only investigation we've done is like, do other health units have this? And are we an agency that can even apply? Is it? And so I just want to maybe just put that out if that's what we're suggesting.
Yeah, go ahead, Robert.
I don't think you need to amend the motion, and I'd like to second it. Okay. If it's been proposed.
Yeah, I think you're still under the investigative portion of it, and I mean, obviously, as you reach in and identify more information, and that it'll give you a clearer picture of what's going to be needed. So in the meantime, just reach out, see what makes sense and what we can do and can't do, and see how the others are implementing, or how they have implemented that, their plan and that. And I think then come back to the board. Okay, any further questions or comments? All right, then I know Tracy, you were moving, and I think Gary Kushak had said that he would support the motion. Anyone oppose? Okay, then the motion carries.
Thank you.
All right. All right, 8.2, the annual audited financial statements. Lori?
Just going to share my screen.
That's on page 14. Yeah.
I'm hoping everybody can see the slide deck. So on page 14 through to page 69 of the package of the board, we have the financial statements for the Windsor-Essex County Health Unit for the year ended December 31st, 2021. Additionally, we have the financial statements for the programs funded by the Ministry of Children, Community and Social Services, namely the Healthy Babies, Healthy Children program and Nurse Practitioner program. And that has a year end of March 31, 2022. So I just intended for the next couple of slides just to go through some, at a high level, certain key components of the financial statements as you have included in your package. So we'll start with the Windsor-Essex County Health Unit statements and the statement of financial position. The statement of financial position has 4 key elements. Those are the financial assets and the financial liabilities, the non-financial assets, and the cumulative deficit. Financial assets predominantly consist of your cash and cash equivalents, as well as your accounts receivable. Those have increased year over year by $3.3 million because of an increase in dollars in bank related to prior year settlements with the Ministry of Health and as well as the Ministry of Children, Community and Social Services. Financial liabilities likewise have gone up $3.2 million. And again, the very much as a result of settlements that have yet to be reclaimed from the ministry, that have yet to be reclaimed from the ministry, and in addition, amounts that have yet to be repaid back to the municipalities. So for the board's information, there are the 2019 and 2020 settlements that remain outstanding at December 31st, 2021. In the period subsequent to year end, I've actually had discussions with the ministry and they have reviewed our settlements and they're in the process of finalizing sign-offs once the balance of the reviews have been completed. Our non-financial assets consist of our tangible capital assets, computers, desks, other pieces of equipment that assist the health unit in performing its daily operations. And then the community deficit, not uncommon for an organization such as this to have a deficit at the end of the day. We do have employee feature benefits that we have to show as a liability on the financial statements, but that liability is extinguished over the life of the employees associated with those benefits. The statement of operations, focusing primarily here on the settlement and reconciliation with the Ministry of Health. Our total program expenses were $28.7 million. From that, we remove or add things that the Ministry of Health considers not to be eligible. For example, we have expenses such as amortization and changes in employee feature benefits that are really a function of the accounting standards that we are required to abide by in the audited financial statements. For the ministry's purposes, however, they are mostly concerned with the assets that we acquire in the year, as opposed to the amortization related to the assets that we have on our balance sheet. From that, we also remove the impact of any offset revenue that is earned by the health unit to come up with the admissible expenditures to be settled. So that is $28.5 billion. For the 2021 year, we had a ministry approval of $15.9 million. Municipal contributions net of the mitigation funding is 5.5. Our mitigation funding from the Ministry of Health is 1.2, almost 1.3. And we also received additional dollars associated with COVID of 5.7. Now for the financial statements for the Ministry of Children and Community Social Services for the March 31st, 2022 year end, the statement of financial position. Again, similarly, there are financial assets comprising of cash, financial liabilities comprising mostly of amounts due to the Ministry of Children and Community and Social Services for the 2021-2022 year end. Financial assets mostly representing the remainder of computers that are used in the course of operation. And then again, accumulated deficit, similarly to what we see for the health unit. From a settlement reconciliation perspective, total program expenses on the financial statements are $2.1 million. We remove the impact or add other things that the ministry is concerned with. So again, as I said, amortization and change in employee future benefits are not something they're concerned of, but we have things like tangible capital assets and other non-financial assets that they are concerned of in the reconciliation process. This leaves us with total admissible expenditures of $2.1 million, a ministry approval of 2.8, and then a liability for the 2022 fiscal year of $734,000. So that is found in, if I were to go back to this slide, that liability would be accounted for in this financial liabilities line. So I'm going to stop sharing my screen for a moment. So then we have in your package, and forgive me, I just have to reference the page. Starting on page 17 of your package, there is a motion. Whereas on June 16th, 2022, the Audit Committee for the Windsor-Essex County Health Unit reviewed the annual financial statements and recommended them to the board for approval. Now and therefore, it be resolved that the Windsor-Essex County Board of Health approve the annual audited financial statements of the Windsor-Essex County Health Unit for the year ended December 31st, 2021. The annual audited financial statements for the Windsor-Essex County Health Unit Ministry of Children, Community, and Social Services Program Initiatives for the year ended March 31, 2022 be approved. If anyone has any questions, happy to entertain them now.
Thank you, Lori. Any questions or comments on the financial report? Hearing none, then a motion then to adopt the report as presented by Lori. Thank you, Joe. And do I have support?
Yeah, Gary Kashak.
Thank you, Gary. And no further questions or comments opposed to the recommendation. Recommendation carries. Thank you, Lori.
Thank you.
Okay. All right, so then we'll move on to 9.0 under new business. 9.1, our CEO quarterly report from the period of April to June 2022, located on page 70. And Nicole, if you want to highlight your report.
Yep. So all the standard items, are there. Just noting at the bottom. So we continue to revise our finances and resources as it relates to the COVID-19 pandemic. So we are still in an organizational emergency response, and as such, our operations are shifted, including redeployments to meet the needs of our organization. And those are reported obviously back to you on a quarterly basis and updated. As well, we'll just note one of the items on the report is any claims related to our insurance. So we do have one claim related to an air conditioning unit that was stolen from our office. So that claim is, around $6,000 to $10,000. So just noting that for your information as well, and no other claims or, report to make at this time, and certainly happy to answer questions.
All right, any questions or comments? Then a motion to receive the report from our CEO. Thank you, Mark. Moved and supported by Gary. Thank you. Opposed? Then the motion carries. Thank you. All right, members of the board, at this moment, we need to move into the committee of the whole in a closed session in accordance with section 239